Well, diabetes is a huge problem here in the Valley, and local doctors say it is especially prevalent among Latinos. Now, Adventist Health is trying to spread awareness about the disease in a very visual and a very unique way. And joining me now is Dr. Mario Martinez with Adventist Health and Community Care. Very nice to have you with us on our program.
Thank you for having me.
Absolutely. Dr. Martinez, tell me a little bit about diabetes, especially here in the Valley. Is it a huge problem?
It's a huge problem. It's something I see every single day in the clinics and also in the inpatient wards. I also do a lot of obstetrical care, and we also even see it with our obstetrical patients. And very serious disease that we see very rampant in our community.
Okay. You said very serious. So what can happen if it's not treated?
Diabetes has lots of different complications. It's one of those diseases that you don't really have symptoms until it's in the later stages. But it can cause a lot of things like diabetic neuropathies, where you'll get pains in your legs. You can lose function in your kidneys. You can, it affects your vasculature, so you can lose your limbs. You can lose your vision. It has tons of complications, and it's a whole systemic process, so it can have pretty much manifestations in any part of your body.
And it's more prevalent with some communities more than others, and Latinos being one of them, right? Can you tell me about that?
Yeah, so the Latino diet and the Latino culture has a lot of great foods, but oftentimes it's unfortunately not so good for your sugars, not so good for your health and your cholesterol. And diabetes is one of the things, like heart attacks and strokes are the things that we try to prevent, and diabetes control is one of the things that we can do to help alleviate or prolong your life.
Okay. All right. And so I know that you are starting something new, something a little bit different to reach out to the Latino community, right? Tell me a little bit about that.
Yeah, so Adventist put out a kind of telenovela kind of a segment where it's 10 episodes, 1 minute each. It's kind of in between commercials. And it's basically a segment where we're trying to educate the public about diabetes and some of the health disparities and ways that you can improve your lifestyle, things you can do to improve your diet and exercise and promoting those kinds of things. And so this segment kind of takes you through a process with the character's named Esperanza, and she kind of goes through the diagnosis of diabetes and how her family gets her to see her primary doctor in Adventist clinics. And the doctor sets out a plan for her to implement in terms of healthy living, diet, exercise, sets her up with a nutritionist, and really gets her through the management of diabetes, the understanding of diabetes, and getting her healthy again.
Wonderful. And of course, novela, a way to attract Latinos because that's what they enjoy watching, right? And they can be familiarize itself with it. So let's take a look. I know we've been watching some video, but let's take a look and listen into a little bit of the dialogue.
Esperanza ha estado tratando de controlar su diabetes para poder reunirse con su familia en México para la Navidad. Pero es otro miembro de la familia quien recibe una mala noticia.
Tengo aquí sus resultados de su última visita y parece que estás en riesgo de padecer diabetes gestacional. Así que vamos a tener que trabajar con la dieta y también hacer mucho con el ejercicio.
Pero eso nunca me ha pasado con mis otros hijos. ¿Qué significa eso?
Algunas mujeres pueden desarrollar la diabetes gestacional. Esto no significa que tuviste diabetes antes, pero es un indicador que necesita regular tus niveles de azúcar en la sangre para que tú y su bebé estén saludables.
I love that music you use. It's so dramatic.
Yeah, it really kind of gets that telenovela feeling to it.
That we're talking to serious business here, right?
Exactly.
And so you were talking specifically about gestational diabetes. Tell us a little bit more about that.
So yeah, I work in the clinic and I see a lot of obstetrical patients, and I get to do deliveries in my job. So one of the complications is gestational diabetes, which basically is diabetes during pregnancy, and it's induced by pregnancy. And so my job is to make sure that we screen for it appropriately. So we really encourage anyone to come see their primary doctor to get screened for it, and also just to do education on ways that they can prevent it, for one, and also to, if they were to have it, to treat it and get the sugars down.
Okay. So I know earlier that you mentioned that the Latino diet often has a lot to do with it. So when you're treating patients, it's about changing their lifestyle, specifically, obviously, what they're eating. So we have some tips on here, but tell us a little bit about preventing gestational diabetes here, and specifically about pregnancy. What should women be doing?
So for one, we always recommend a lot of water. And then also just be conscious about what you're putting in your body. The way I kind of try to tell my patients is try to think of anything that you eat, you're feeding your baby. So things high in fat, we avoid fast foods, avoid foods with a lot of sugar, artificial sweeteners, and we try to promote the healthier foods like vegetables and fruits, and we encourage a lot of fibers, whole grain foods, and things like that. And just really try to be conscious about the amount that you're eating as well.
So earlier we were talking and you said a lot of times it's just a lack of information because once that information is out there, right, and some of your patients know that they have this disease, that they have diabetes, and know these are the ways in which you can prevent complications, do you find that they really get on board?
You know, it's really about how motivated the patient is, but I, as a physician, want to get on their side. I want to be part of their team, try to get them in a relationship that they can trust what I'm saying and also implement it once they go home. You know, it's real easy for me to say to, you know, just get on a diet and exercise. To really gain that trust and have the patient understand why it's important, and also let them know that I'm there to support them through the process and having regular checkups to make sure the weight's going down, to make sure the diet's getting better. That's part of my job that, you know, I see the most success when you have that kind of relationship.
Very quickly, I did notice that the name of the main character in this novela was Esperanza, which means hope, right? So is there some symbolism behind that?
Oh, definitely. You know, telenovelas always have to have those little underlying things.
So this is, you know, a novela full of hope because if you do things right and you take care of yourself, then you should be able to control it, right?
Exactly.
Okay.
Exactly.
Wonderful. Thank you so much, Dr. Martinez, for being with us this morning.
It's been a pleasure.
Likewise. All right, if you suspect that you may be at risk for diabetes, make an appointment with your nearest Adventist Health Community Care Clinic. You can call the number on your screen or learn more at ahsaludporvida.com. You can also watch Esperanza episodes online, and we'll have a link on abc30.com. Just click on Latino Life.